Now we want to tell you about a groundbreaking moment in medical history at Northwestern Medicine. Doctors successfully performed a double lung transplant on a coronavirus patient.
And that patient's story is traveling around the country in hopes that the surgery that saved her life could save others battling the virus. An operation first of its kind in the U.S. and potentially a new weapon in the fight against the coronavirus.
I can very confidently say that if she didn't get the transplant, she would not be alive.
You're looking at lungs devastated by coronavirus. Doctors said the damage was some of the worst they've seen in a patient so young. The woman in her 20s had been healthy prior to the virus. Last week, a double lung transplant performed by doctors at Northwestern Memorial Hospital was her only hope.
This important milestone indicates that while the transplant procedure in these patients is quite challenging, technically, it can be done safely. And it offers the terminally ill COVID-19 patients another option for survival.
The patient underwent surgery only after there was no evidence of coronavirus. The surgery lasted 10 hours, longer and more difficult than other lung transplants due to irreversible scarring and inflammation.
This is a milestone, not only improving the care for this patient, but also giving hope for future opportunities.
The woman's identity is not being released. We're told she's Hispanic, lives in Chicago, and had a minor illness that required medication that suppressed her immune system when she contracted the virus. Just days ago, her organs were shutting down. Now she's awake, smiling, and expressing her gratitude.
She said, "Doc, thank you for not giving up on me."
And that patient is in the ICU, could go home in 2 to 4 weeks. Doctors are also closely monitoring coronavirus survivors who have been on ventilators to see whether they have scarring in the lungs that could lead them to also need transplants.